Okay, so in this scenario, I'm gonna show how to administer IM adrenaline through intramuscular injection. What we're gonna need is an alcohol swab because that's the gold standard. We're gonna have our sharpener container. We're gonna have our suck-up needle and injecting needle. So first of all, we're gonna open. First of all, we need to get consent from the patient, which in this scenario we're just gonna assume that we have gained consent, and the patient is suffering an anaphylactic. He's an anaphylactic situation. So what I'm gonna do is I'm just gonna open the alcohol swab and clean the area that I'm gonna administer the injection in. Wait for it to dry while I do my drug check and join up my drug. So to do the drug check, it's a 1 milligram of adrenaline into 1,000 ratio. Used for IM, as I've stated previously. So just making sure there's no adrenaline stuck at the tip of the capsule. So just give it a little shake. It's good. Just gonna break it now and dispose it in the sharpener. So what I'm gonna do first now is I'm gonna get my suck-up needle, put my adrenaline upside down, and at this stage I only need to administer 0.5 milligrams of adrenaline. However, I'm gonna join more to make it easy and eliminate any excess. To get rid of any bubble, I'm just gonna give it a quick shake. Make sure. Looks good. Okay, so I'm gonna put the needle back by a one-hand way. Do so I don't hurt myself, and I'm gonna get rid of this and put it in the sharpener. Then I'm gonna put my injecting needle in, which in this case we used a 32 millimeter needle. So what I'm gonna do is I measured it prior to this scenario, and the way I measured this was I pitched the skin, and I'm only gonna use half of it. So before I inject it, I'll gain consent of the patient. Say, hey sir, I'm just gonna put the injection in your lateral thigh, if that's okay.
Yep.
Sweet. So just checking again. Gonna put a zit line, zit stretch, and hey, I'm gonna inject it now, and join up a little bit to make sure we didn't hit a vein or anything, so there's no blood coming out. So that's good. And we're just gonna slowly inject the adrenaline in, and slowly just grab it out. Then we're gonna use the same technique to get rid of this needle. One hand technique, and get rid of it in the sharpener. In the case of real life scenario, I will get my off-stander to check the drug and the reliability and the date of it, of course. In this case, in this scenario, it's irrelevant. However, it expires in the 2012, and it's obviously expired, but in the case of this scenario, should do it. Okay, so in this scenario, we're going to show you guys how to administer an LMA in case you are in a cardiac arrest or any situations of which you want to secure the patient's airway. So first of all, what we want to do is put the patient in a sniffing position and check his airway. If there's nothing blocking the airway, everything seems fine, and there's nothing in the airway. And secondly, we're going to put the towel under their hip to try and align their earlobe with the shoulders. As you can see now, it's perfectly aligned. What are we going to do now is we're going to do the CPR, 30 compressions to 2 ventilations, to every 2 breaths. So first of all, I'm just going to ventilate my patient. Nice chest rise. While my off-stander is going to do carry on with the compressions, I will I'll put my OMA in the patient. So just turn it around, put it in there. Then again, probably ventilate the patient again. and then I'll get my my LMA and ready. So I'm gonna loop it up, and I'm gonna put this on his head. Then I'm gonna ventilate the patient again. 1 and 2. Okay, while we do that, I'm gonna take the OMA out now and insert the LMA. It's a size 3, so we're gonna put 20 mils of air in there. So just make sure it's in. Okay, perfect. So what we're gonna do now is also ventilate the patient again before we carry on and secure it with Thomas tube holder. As you do that, and make sure to put the teeth out near the teeth so they don't bite the tube off in case they woke up from their cardiac arrest. Just tighten it there, and do this so, like so. Make sure it's tight, secure. Then I'm going to ventilate the patient again. Good chest rise. In case of the patient was not, if I didn't notice any good chest rise, I will have to troubleshoot it using the DOPE's acronym, of which they will be for dislodged, which is the actual tube, which seems to be intact. Then I will be looking for any airway obstructions. There's no seem to be any airway obstructions. Then I will be expecting a pneumothorax in this situation. However, the patient doesn't seem to have any pneumothorax. After that, I will assess all my equipment and make sure everything is intact and there's nothing that my equipment are not failing. And everything seems intact and right place. This would mean one more thing, which is a stomach distension. And yeah, and that's how you apply an LMA to your patient. Okay, well in this scenario, we're going to show you guys how to apply an LMA into a pit. In this scenario, we can just assume that the child has drowned and he went into a cardiac arrest due to being hypoxic. So ventilation is essential. So first of all, what we want to do is align the body, but due to them being smaller than adult size, the towel will be placed under the shoulder. So to align them, we're just going to put the towel just under the shoulder and secure the airway. Check there's nothing in, and you can see it's aligned with the shoulders because they're a lobus chest, perfectly aligned with their shoulders. So first of all, when I get my off-standard to start his compressions, the rate will be 15 compressions to 2 breaths. So as you do his compressions, I'm putting my OPA in. Right, so I'm going to ventilate the patient. Good chest rise. And now, because in this scenario we don't actually have a Thomas tube holder, and we're going to use tape. So first we're just going to loop the LMA like so, and make sure you just inflate it a little bit so it's easier to go into for the child. We're going to ventilate the patient again before we proceed in putting the LMA in. Okay, so we're going to take the OPA out. We're going to use a tongue presser to press the tongue back when we put the LMA in. So like doing so, and perfect, and then we're gonna inflate it. We're using a size 2, so we're gonna put 10 mils of air into the LMA. So I'm just gonna ventilate the patient again before I secure it using tape instead of Thomas tube holder. Okay, so now we're gonna use the tape. I'm just gonna put this there, so. And turn it around like that. Then we're gonna use another one for the other side. Do this. Then we're gonna do that. Sweet. So now the LMA is secured, and I'm going to ventilate the patient again. In case of failing to in case it didn't seem to be working properly, I'll troubleshoot it using the DOPE's acronym, of which D will be standing for dislodged. In this case, it doesn't seem to be the chip doesn't seem to be dislodged. Then for obstruction, so airway obstruction, and pneumothorax. The patient doesn't seem to have pneumothorax due to good chest high rise. So we're going to check for equipment failure. We'll check bones, everything seems inflated, and everything seems intact and placed. So it's not equipment failure, unless it would be a gastric distension. And that's how you apply an LMA into a pit.